Week 10 Minute Review. Cardiac arrest. Increased survival with immediate defibrillation and bystander CPR. Survival depends on pre-arrest condition, length of arrest, longer than 15 minutes increases mortality, and after arrest condition, blood pressure and return of consciousness. Post-arrest care include correcting the underlying causes and hypothermia. If patient doesn't return to consciousness 32 to 34 degrees Celsius for 12 to 4 hours post-arrest. Pulmonary embolism. Obstruction of blood flow to an artery by a thrombus in the pulmonary vessel. It can be fat, air, foreign body, or clot. 90% of PEs originate from a DVT. The symptoms are impending doom, acute dyspnea and hypoxia, tachycardia, tachypnea, hypotension, possible new murmur, JVD, and it can lead to right heart failure. Diagnosis is a VQ scan and a spiral CTA. DVT prophylaxis is crucial. SCDs, TED hoses, heparin Lovenox, and early mobilization. Treatment is oxygen, possible fluid volume load, IV fluids to increase myocardial stretch to increase the coronary artery perfusion. Anticoagulation, heparin is 1 mg per kilogram twice a day. Surgery and embolectomy, IVC filter, and lysis existing clot with alteplase. Pulmonary edema. Fluid leaks from the pulmonary capillaries into the alveolar space where gas exchange occurs. Causes are left-sided heart failure, increases the pulmonary pressure in the pulmonary vessels. Signs and symptoms are shortness of breath, crackles, rales, hypoxemia, pink frothy sputum. Treatment is diuretics, Lasix, oxygen, nitroglycerin to reduce the afterload, dobutamine and millerone to increase the contractility of the heart, and oxygen if needed. Complications is that over time it can lead to right-sided heart failure. Cardiac tamponade, the accumulation of fluid in the pericardial space that compresses the heart. The heart can't fill when it compresses. This decreases the cardiac output. Causes are pericarditis, cancer, and cardiac surgery or procedures and trauma. Assessment is Beck's triad, diminished heart sounds, JVD, and hypotension. Pericardial friction rub and pulses paradox. Diagnosis is done by an echocardiogram. Complications are PEA if not treated, and treatment is pericardial window or pericardocentesis. Pleural effusion. Fluid leaks from the pulmonary capillaries into the pleural cavity surrounding the lungs. It's caused by left-sided heart failure, malignancy, pulmonary embolism, trauma, infections. Signs and symptoms include shortness of breath, chest pain, orthopnea, and diminished breath sounds, non-productive cough. Treatment is diuretics, oxygen, nitroglycerin to reduce the afterload, dobutamine and millerone to increase the contractility of the heart, and oxygen if needed. Complications include severe fluid or patient non-responsive to medications may need a thoracentesis. Recurrent pleural effusions may be treated with a Pleurex catheter. Chest tubes are used for very large effusions. Cardiogenic shock. Failure of the heart to pump to meet the metabolic needs of tissues and organs. The assessment includes signs of left-sided or right-sided heart failure, impaired tissue perfusion, mottled, cool, clammy, or blue extremities, dyspnea, anxiety, hypotension, tachycardia, gastric hypomobility, oliguria, change in level of consciousness, delirium. Treatment includes intubation, IAPV, or LVAD, surgery to repair the cause. Medications include inotropes like dobutamine, millerone, or dopamine, vasodilators like nitroglycerin, antidysrhythmics like and vasopressors, epinephrine if severe for hypertension. Acute arterial occlusion is a thrombus or embolism that obstructs an artery causing tissue ischemia. Emergency recognition is used to prevent the loss of limb. Causes are embolism, causes for an embolism is AFib, for a thrombus is atherosclerosis, aneurysm, hypercoagulable disease, vascular graft, or a laterogenic emboli is a medically induced emboli, for example, an air emboli or a medical equipment debris. Assessment includes extremity of the pain, coolness, paresthesia distal to the occlusion, pulselessness, pallor, paralysis, pain, paresthesia, and the inability to distinguish hot or cold. Tests include an arterial Doppler study for diagnosis, an arteriography before the embolectomy, an echogram to evaluate the cardiac source and rule out any other cardiac disease or abnormalities, and the treatment, pharmacological, it's a fibrolytic therapy in heparin. Surgery, it's a balloon embolectomy, the removal of the embolus, arterial bypass procedure, a fasciotomy, a procedure that cuts away at the fascia to relieve any tension or pressure. Thrombolysis takes 6 to 72 hours to take effect and should only be used if the ischemia is not limb-threatening and if the ischemia had been occurring for less than 14 days. ANA scope and standards of practice. Standard 1, assessment. Data is comprehensive and pertinent to the patient. Standard 2, diagnosis. Determine diagnosis or issue. Standard 3, outcome identification. Develop a plan of care for the individual. Standard 4, planning. Design strategies towards the outcome goal. Standard 5, implementation. Coordinate interdisciplinary care and patient teaching about health and health promotion. Standard 6, evaluation. Evaluate how patient is progressing towards their goal. Standard 7, ethics. Nurse practice ethically. Standard 8, culturally congruent practice. The nurse practices in a manner that is congruent with cultural diversity and inclusion principles. Standard 9, communication. Nurse communicates in an effective manner. Standard 10, collaboration. Nurse collaborates with patient, family, physician, therapist, interdisciplinary approach. Standard 11, leadership. All nurses are leaders. Standard 12, education. Nurses stay up to date with current nursing practice. Standard 13, evidence-based practice and research. Nurses use evidence-based practice integrated into their practice. All nurses participate in the research. Standard 14, quality of practice. Nurse contributes and gives quality care. Standard 15, professional practice evaluation. Nurse self-evaluates their own professionalism against the professional standards, guidelines, rules, and regulations. Standard 16, resource utilization. Nurses are fiscally responsible without sacrificing safety and effectiveness of care. Standard 17, environmental health. Nurses maintain a safe work environment. Advanced directive. For anyone 18 and older, includes living wills, do not resuscitate decisions, organ donation preferences, and power of attorney forms. Pulsed. For the seriously ill, includes directives for intubation, antibiotic use, feeding tubes, and other treatments. Autonomy. Patients' right to make their own decisions without undue influence. For example, if a patient asks the nurse, "What would you do?" when trying to decide on getting surgery or not, the nurse declines to answer and helps the patient to understand all the facts of the situation. A nurse may not unduly influence a patient's decision. Self-determination. Patient has a freedom to act independently. Limitations. Limits the autonomy when patients in the risk of harm to self or others. Informed consent. It respects autonomy. Decisional capacity. Surrogate authority priority. So a court-ordered guardian, then a POA, spouse, adult children, parents, and adult siblings. Nurse character. Veracity. Truthful disclosure of errors. Privacy and confidentiality is medical reports only, accesses to those directly involved, and HIPAA. Fidelity. Nurse follows all the promises, codes, ethics, policies, and duties. Nurse puts patient's interests above other interests and honors agreement made to patients. Provision 1. The nurse in all professional relationship practices with compassion and respect for the inherent dignity, worth, and uniqueness of every individual, unrestricted by the considerations of social and economic status, personal attributes, or the nature of the health problems. Provision 2. The nurse's primary commitment is to the patient, whether an individual, family, group, or community. Provision 3. The nurse promotes, advocates for, and strives to protect the health, safety, and rights of the patient. Provision 4. The nurse is responsible and accountable for individual nursing practice and determines the appropriate delegation of tasks consistent with the nurse's obligations to provide optimum patient care. Provision 5. The nurse owes the same duties to self as to others, including the responsibility to preserve integrity and safety, to maintain competency, and to continue personal and professional growth. Provision 6. The nurse participates in establishing, maintaining, and improving health care environments and conditions of employment conducive to the provision of quality health care and consistent with the values of the profession through individual and collective action. Provision 7. The nurse participates in the advancement of the profession through contributions to practice, education, administration, and knowledge and development. Provision 8. The nurse collaborates with other health professionals and the public in promoting community, national, and international efforts to meet health needs. Provision 9. The profession of nursing, as represented by associations and their members, is responsible for articulating nursing values, for maintaining the integrity of the profession and its practice, and for shaping social policy. General adaptation syndrome. Han-Sile stages of body response to the stressor. The alarm stage. The central nervous system is stimulated, flight or fight syndrome. Stage of resistance or adaptation. Person continues fight or flight response, but the body tries to counteract the psychological changes by the parasympathetic system. Stage of exhaustion. Compensatory mechanisms run out, leading to stress-related dysfunction and depression. Congratulations, this is week 10.